Is that better? So it's great to meet everyone. I'm Steve Barnhill. As he said, my background is that I'm a physician trained in clinical pathology and laboratory medicine. I've basically been chairman and CEO of public and private companies for the last 35 years. My first company was a clinical laboratory that I sold to Corning-MetPath, Quest Diagnostics, and stayed on as a medical director for that facility for 5 years, and then moved into the world of artificial intelligence back in the late 80s. Developed a company that primarily focused on neural networks, which was an earlier AI technique that we used. And I sold that company. That was mostly in cancer diagnostics. And I sold that company to a New York-based pharmaceutical company, stayed on and ran it as president for several years. And then we moved into a higher dimensional artificial intelligence technique that we needed because we were going to a much higher dimensional space like the human genome. So we started a company using a more robust technique called support vector machine. And the neural network patents were sold to Johnson & Johnson. And throughout this time period, mostly as I said, in cancer diagnostic work, I've negotiated and executed deals with Pfizer and Quest and Abbott, LabCorp, Clarient, Bruker, and a number of other companies. And retired from that world in 2012 and got into the cannabis side of things because it really helped my mother, who was diagnosed with pancreatic cancer. And I was new to this. And so in the last 8 years, I have been specializing specifically in this cannabis space. So I went and gave a talk at the medical school down in Jamaica, and we ended up opening a place where we can do clinical studies, clinical trials. We are licensed, fully licensed for cannabis. We have a full medical team that treats patients, and our health and wellness center just won first place in the world for the top health and wellness center for cannabis patients to be treated. And now we have come into the mushroom world for a number of reasons, and mainly because we believe very strongly that combinations of cannabis and mushrooms can be a much better therapeutic. As you guys are aware, a lot of the cannabis illnesses and mushroom illnesses that are treated are the same. And we have treated patients with cannabis alone. We are now building these mushroom products that combine with cannabis. Now, it makes sense, right? So, for example, in cancer, you hear a lot of talk about psychedelics for psychiatric disease, and yes, we do that. And it has been shown that if you use psilocybin with CBD from cannabis, that actually it makes the trip more productive, it makes the trip more effective, and it significantly reduces the paranoia and the anxiety. Well, it's the same with cancer. I don't know if a lot of people are familiar with this, but cancer is treated around the world in approved products in some cases with compounds from mushrooms, particularly in Asia. So we have edible mushrooms, for example, like shiitake and reishi and tiger tail, that actually have cancer compounds, cancer-fighting compounds in them. We also know that cannabis has cancer-fighting compounds in them. So, for example, if we were going to look at combining a certain compound from mushrooms like lintenin or triterpenes, which we know kill certain cancers, and we combine that with other products in cannabis like THC, CBD, CBG, etc., then we should have a synergistic effect, because with one, we may be dealing with apoptosis, programmed cell death, which is what some chemotherapies do. That's one of the pathways we kill cancer. Anti-angiogenesis is another pathway. So we may actively be able to affect multiple cancer-killing pathways by combining these products together. And we could give similar examples as antivirals. We certainly know that terpenes in cannabis can be antiviral. We also know that beta-glucans in mushrooms can be antiviral. We are using this in obesity. You guys are probably familiar with that. THCV is one of the cannabinoids that's used for obesity. But we also have compounds in mushrooms that are used to suppress the appetite. So our company is really dedicated to what I call combinatorial pharmaceuticals, where we are combining, using artificial intelligence techniques, we are combining the most important healing compounds from mushrooms with the most important healing compounds from cannabis to create more effective treatments. We are in a very unique situation to be able to do that, because mushrooms, the magic mushrooms, the psilocybin mushrooms, for example, are only legal in very few places in the world. They're legal in Brazil, but you can only use them as the mushroom itself. Once you distill it, it's a Schedule I drug. They're legal in the Netherlands, but only as truffles. Once you distill them, it's a Schedule I drug. It's illegal in the US, it's illegal in Canada, it's illegal most of the world. Jamaica happens to be one of the very few, if not the only countries now, where psilocybin mushrooms are as legal as a mango. It's never been made illegal. And so there are psilocybin mushroom retreats in Jamaica, and you can get access to these mushrooms. Now, Jamaica is also a medical cannabis federally legal country if you're licensed. I happen to be licensed in Jamaica for all of the cannabis licenses that allow us to cultivate and to produce these oils and to make products. And we do a very good job. We actually won High Times Cannabis Cup, first place for indica division, which is the type of cannabis that we use for treating cancer patients, for example. We also won the Jack Herer Cup for best oil, first place, best solvent oil. So we have an extremely experienced team down there. And we're in this one place in the world where we can add mushroom ingredients to cannabis ingredients and create new products and file patents on those formulations early. And the biggest advantage to filing these blocking patents early is most of the rest of the world is legally limited in this kind of work. So this gives us a huge head start on developing an intellectual property portfolio, which brings us back to today and what Graham mentioned. We filed a press release this morning. So you guys are actually the first ones to hear us talk about this, but we filed a press release this morning on our first 5 patents that have been filed. We have filed patents for combinatorial products for cancer, for obesity, for psychiatric illnesses, for inflammation, inflammatory conditions, and as an antiviral. And these are extremely complicated patents. And we think that we've covered both the independent and dependent claims very well. By the way, in my background, I am an inventor on over 40 patents. And I will tell you that my patents were part of the patent portfolio that won MDB Capital's MECO Award, first place out of 1,600 publicly traded companies of having the most disruptive patent portfolio. So this is patenting these new formulations are very important to us. So we have the first 5 patents out now. We also are protected through the PCT for 170 countries globally. And we are also protected through the Paris Accord, which allows us to also patent countries that are not in the PCT, like Jamaica, and as well as the USPTO. So I mentioned artificial intelligence. That's really my background, and my 40 patents are specifically in that space, but related to cancer diagnostics. So how does this work? So when you take 100 cannabinoids and you take 26 flavonoids and 100 terpenes, and you take products out of the mushrooms, and you have 1,000 products in various mushroom species. When you combine all this data together with patient data, what happens is it will tell you which are the most important aspects to treating a certain condition. For example, when I was running a US public company, we identified 4 genes for prostate cancer out of 30,000 genes, right? So how do you do that? Nobody can look at a list of 30,000 genes and say, oh, I think these 4 would diagnose prostate cancer. You have to use AI, and AI will get to the most important genes to make that distinction. Well, it does the same thing with formulations. So we will be able to take thousands of pieces of information, and we'll be able to distill that down to formulations that are specific for certain diseases. Now, I will tell you also with our cancer work, we have 24 formulations already established, and these are all getting ready to be tested with 3D cell culture across 10 different cancer cell lines in 9 different concentrations. So we should be able to have some very good data showing that the combination of these anti-cancer compounds in mushrooms, when combined with anti-cancer compounds in cannabis, will give us a much more effective treatment than either one by themselves. Now, keep in mind that for the psilocybin mushrooms, and there's 180 species of mushrooms that have psilocybin in them, they also have a lot of other compounds that may have no psychedelic effect at all, but may be helpful in cancer patients. It may be helpful in inflammatory disease patients. It may be helpful in antiviral patients. So we will be looking at all of these different compounds, but we're able to study all of the compounds in the psilocybin mushrooms in Jamaica, as well as all of the compounds that are in the edible mushrooms in Jamaica to create these things. Now, one of the other things that we're working on is to be able to not only look at these new products that we're protecting with the IP we released today for cancer, but we want to be able to also take a patient's actual tumor. And we're working with a group in Europe now that have the machine to do this. We can take a patient's actual tumor and try our formulations on that tumor, and then tell that patient which formulation best works on his particular cancer. This is true personalized medicine. The other thing we'll be doing is looking at the human genome. We draw blood on all of these patients so that we can look at their whole genome sequence. And let's say 50% of patients respond, breast cancer patients respond and do well, and 50% don't. Well, we can then look into the human genome, just like we do with cancer triage, with chemotherapy and radiation, and with these genetic markers. And we can say, okay, if you have this genetic pattern, you're more likely to respond to this treatment. If you don't have this genetic pattern, then you're less likely to respond, and maybe we should look at a different treatment, because one thing cancer patients don't have is time. So we don't want to waste their time on something that might not work. So at the same time that we're building the formulations, we're also building the genetic markers to help us triage patients into the correct formulation for their specific illness. And as I said, this is a really, really unique opportunity for me, because if I were not licensed for medical cannabis in Jamaica and be in Jamaica where mushrooms, including psilocybin mushrooms, are legal, we wouldn't be able to do this type of work. So I think we're going to be way ahead of the game. We are not a psilocybin only company. We are not a Me Too psilocybin company. We do absolutely appreciate the work that's been done at Johns Hopkins and the work that's being done around the world on psilocybin. We think it's a great drug, but they have already shown themselves, that community, that if you combine CBD with it, it makes it a more effective treatment with less paranoia and anxiety. So they're already proving our point that these two plants seem to work extremely well together for patient treatment success.